And people say that it may be fractured from the anterior calcaneum or the adjacent cuboid bone. So here, this is one case. That was just an incidental finding. I was actually reporting on this fracture here when I noticed that there was a small little os calcaneus secundarium there. But in this patient, there was no midfoot pain. The pain was soft tissue swelling related to that injury. So there are other ossicles in the foot. The os fibulare beneath the lateral malleolus. Most schools of thought is that it's actually a non-united avulsion fracture involving the anterior talofibular ligament. I sadly don't have any image of that. Another is the os subtibiale. Again, perhaps an ununited avulsion fracture from the inferior tip of the medial malleolus. And I again don't have a very nice image of that. This is a very extreme case of os substentaculi related to the back of the substentacular tali, and this unfortunate 18-year-old has bilateral and eventually actually needed to have surgical resection because he was having constant pain while running. Os subcalcis, it's contentious. There are articles that say that it's actually detached or fractured anticipite from the calcaneum rather than the related to the plantar fascia. The proper definition is actually it's proximal to the anticipite. So there are other ossicles in the foot. The os cuboideum secundarium, which the infranavicularis. So for this, you actually need to have a very open mind, suspect that what you see is an ossicle and not a fractured fragment, and have this diagram in mind if you can remember. So let's talk about the sesamoids. So sesamoids are osteostructures, either partially or totally embedded within the tendon. Basically, you actually reduce the friction and reduce injury to the tendon, and can be bipartite and can fracture or localize pain, and can even show degenerative changes as well. MR is helpful to assess, to differentiate between a bipartite sesamoid or a fractured sesamoid. So here, the most common type is the helical, the ones related to the head of the first metatarsal bone. And the medial one is the one that commonly is bipartite and also more commonly fractured. So that's where your diagnostic skill comes in. You have the interphalangeal one between the interphalangeal joint of the big toe, and less commonly seen in the other joints, in the other toes. And you actually can have sesamoids related to the heads of all the other metatarsals, although the fifth metatarsal is the more common one.
Reduction of the surrounding tissue. Because crystal deposition and these change can be seen by imaging study. So the cartilage surface, the bone surface, synovium, ligament, and tendon, and sometimes people think it can be detected on joint effusion. So